Chronic sinusitis is an inflammation of sinuses. Look at this picture shows that paranasal sinuses, CT findings, X-ray, PNS findings, look at this, and MRI for soft tissue evaluation. A detail going on. Introduction. Chronic sinusitis, also known as chronic rhinosinusitis (CRS), is a long-lasting inflammation of swelling of the sinuses that persists for 12 weeks or longer, despite attempts at treatment. Unlike acute sinusitis, which usually results from a viral infection and resolves within a few weeks, chronic sinusitis can significantly impact a person's quality of life and may require long-term medical or surgical management. Definition. Chronic sinusitis is defined as a persistent inflammation of the mucosal lining of the paranasal sinuses lasting 12 weeks or more, with or without nasal polyps, despite medical management. Etymology. The term sinusitis is derived from the Latin word sinus, meaning cavity or hollow, and the Greek suffix itis, which means inflammation. Thus, sinusitis literally means inflammation of the sinus cavities. Epidemiology. Chronic sinusitis affects approximately 12 to 60% of global population, making it one of the most common chronic respiratory conditions. It is more prevalent in adults than children, with higher incidence in individuals with allergies, asthma, or environmental exposures. Types. Chronic sinusitis is generally categorized into two main types. One, chronic sinusitis with nasal polyps, characterized by the growth of polyps in the nasal or sinus mucosa. 2. Chronic sinusitis without nasal polyps involves persistent sinus inflammation without the presence of polyps. 3 other subclassifications: allergic fungal sinusitis, aspirin exacerbated respiratory disease. Causes: 1. Bacterial, viral or fungal infections 2. Allergies. Example allergic rhinitis. 3. Nasal polyps. 4. Deviated nasal septum. 5. Asthma. 6. Immune system deficiencies. 7. Repeated respiratory tract infections. 8. Environmental irritants. Pollution, smoke. Risk factors. 1. History of acute sinus infections. 2. Allergies or asthma. 3. Structural abnormalities in the nasal cavity. 4. Smoking or exposure to second hand smoke. 5. Nasal polyps. 6. Weakened immune system. 7. Cystic fibrosis. 8. Occupational exposure to irritants. Example chemicals, dust. Complications. 1. Orbital cellulitis. Infection of tissues around the eyes. 2. Meningitis. 3. Osteomyelitis. Bone infection. 4. Loss or reduction of sense of smell. 5. Chronic headache. 6. Asthma exacerbation. Pathophysiology. Step-by-step explanation of the pathophysiology of chronic sinusitis. Step 1. Triggering factors. Initiates inflammation. A trigger such as infection, viral, bacterial, fungal, allergen, pollutant, or structural abnormalities. Example deviated spectrum. Initiates inflammation of the seasonal mucosa. Steps 2. Mucosal edema and thickening. The inflammation leads to mucosal swelling, edema, and thickening of the sinus lining. This swelling narrows or blocks the sinus ostia, the opens that allows drainage into the nasal cavity. Step 3. Impaired mucociliary clearance. The normal function of the mucociliary escalator is impaired. This leads to mucus stasis within the sinuses. Step 4. Mucus retention and reduced ventilation. Because of the blocked drainage and impaired clearance, mucus and air get trapped in the sinuses. This creates a low oxygen environment which is favorable for microbial growth. Step 5. Secondary infection or colonization. Bacteria or fungi may colonize the retained mucus, leading to low grade or persistent infection. This further stimulates and perpetuates the inflammatory response. Step 6, chronic inflammatory response and tissue remodeling. Ongoing inflammation results in infiltration by inflammatory cells. Example, eosinophils, neutrophils, lymphocytes. Over time, this can lead to fibrosis, thickening of the sinus lining, and formation of nasal polyps. Step 7, persistent symptoms and mucosal damage. The cycle of obstruction, infection, and inflammation continues. The result in chronic symptoms, example, nasal congestion, facial pain, loss of smell, and reversible mucosal damage if not treated effectively. This cycle perpetuates chronic sinusitis, distinguishing it from the self-limiting cause of acute sinusitis. Signs and symptoms. Symptoms persisting for 12 weeks or longer include 1. Nasal congestion or obstruction. 2. Purulent nasal discharge, anterior or posterior. 3. Facial pain or pressure. 4. Decreased or lost sense of smell, anosmia. 5. Headache. 6. Ear pain or pressure. 7. Bad breath. Halitosis. 8. Cough, especially at night. 9. Fatigue. Diagnosis. 1. History and physical examination. 2. Nasal endoscopy to visualize inside the nasal cavity. 3. CT scan of sinuses, gold standard for visualizing sinus anatomy and inflammation. 4. MRI when soft tissue evaluation is needed. 5. Allergy testing if allergy causes are suspected. 6. Culture or biopsy, rarely, to detect fungal or resistant bacterial infections. Nursing diagnosis. 1. Ineffective airway clearance related to nasal obstruction and inflammation. 2. Acute pain related to sinus pressure and inflammation. 3. Disturbed sleep pattern related to congestion and discomfort. 4. Risk for infection related to impaired sinus drainage. 5. Impaired comfort related to facial pain and headache. Medical management. 1. Nasal corticosteroids. 2. Saline and nasal irrigation. 3. Antibiotics only if bacterial infection is suspected. 4. Oral corticosteroids, short term use. 5. Antihistamines or leukotrienes modifiers if allergies are present. 6. decongestants, short-term use. 7. Antifungals if fungal infection is confirmed. 8. Immunotherapy for allergic causes. 9. Biological therapy, example dupilumab for CRSWNP. 10. Surgical management. 11. Functional endoscopic sinus surgery FESS indicated when medical therapy fails. Removes obstructions, improves drainage, removes nasal polyps if present. Nursing management. 1. Educate patient on proper nasal irrigation technique. 2. Encourage compliance with medications. 3. Monitor for side effects of corticosteroids. 4. Promote adequate fluid intake and humidification. 4. Teach avoidance of allergens and irritants. 5. Assess for psychosocial distresses due to chronic symptoms. Treatment options. 1. Pharmacologic. Nasal corticosteroids, saline sprays, antibiotics, antihistamines, oral corticosteroids. 2. Surgical, functional endoscopic sinus surgery, FESS. 3. Adjacent therapies, steam inhalation, allergen immunotherapy, biologics for severe cases. Psychosocial medicine. 1. Cognitive behavioral therapy CBT to help cope with chronic pain, fatigue and reduced quality of life. 2. Support groups provide emotional support and shared experiences. 3. Stress management techniques, meditation, yoga and breathing exercises to alleviate symptom exacerbation. 4. Patient education about disease processes, triggers and coping strategies to increase self-efficiency. 5. Counseling therapy, especially for patients experiencing depression or anxiety due to chronic illness. Prevention. 1. Avoid exposure to smoke, pollutant and allergens. 2. Practice good hand hygiene to reduce infection risk. 3. Use saline sprays or humidifiers to maintain moist nasal passages. 4. Treat allergic rhinitis or asthma appropriately. 5. Avoid upper respiratory tract infections. 6. Regular sinus rinses in high risk individuals. 7. Vaccinations. Example flu shot to prevent secondary infections. In conclusion, chronic sinusitis is persistent, often debilitating condition that can significantly impair quality of life. Early and effective management, including both medical and surgical options, is essential to control symptoms and prevent complications. Holistic care involving physical, medical, and psychosocial interventions enhances outcomes and empowers patients to better manage their condition. Thank you. Have a nice day.